Hi, I'm Dr. Faye Snyder. I'd like to talk to you today about a touchy subject, schizophrenia. We have culturally learned to believe that it's about genetics and not about environment. And it's also not only something we just almost feel like we believe it in our veins and in our blood and in our all our assumptions. We just can't imagine that it's not genetic. I mean, it just seems so so different. People who have schizophrenia seem so different. Their brains must be different. It must be genetic. It must be inherited, but it's not. The brain is affected in the earliest years of life, especially the first year more than any other year. If we don't get certain needs met in that first year, we're not going to be normal. We're maybe even not going to be human. We have to be taught to believe that schizophrenia and any major mental illness is genetic. If we weren't taught it, we probably would have seen more clearly already. It probably would be more self-evident that environment creates personality. There's a big PR campaign. Millions and millions of dollars are pumped into research that can't be replicated that allegedly proves that schizophrenia is genetic. I've been over the research. I can't say I've been over every piece of research because they keep pumping it out and pumping it out. But I can tell you that there's a formula that scientists are using that I wrote about in my book, The Predictor Scale, in order to prove to us that schizophrenia is genetic. And that formula is, it takes a fraudulent approach to science. None of the research that has been produced in the name of genetics has been replicated. That is so important for you to get. I know this sounds far-fetched. I'm pretty much alone out here, and I want you to know that I'm not an oddball. I love the truth. I love facts. I love science. I especially love real science. And I'm not proposing something without replacing it with something better. So as far-fetched as you may think this sounds, I want you to take a minute just to think clearly. Is this so hard to believe? Is it so hard to believe that environment creates personality? So the power of this major pathology, whether it's creating schizophrenics or creating serial killers or creating time bombs, it's rooted in the first year of life. The first year is the foundation of the personality for the rest of our lives. The first year is when the brain starts creating all its synaptic connections. So it's in the first year of life that we get our identity. We look into mommy's eyes to see not only who she is, but who we are. It's in the way mommy looks at us that we know that she's good and that we're good. If she's smiling and enjoying us and making us feel like we're really, really special, then we're good. The world is good. Life is good. If mommy's not seeing us, not delighted to know us, not crazy to hold us, then we start feeling like there's something wrong with us. So it's the first year that we get our core identity from our primary caregiver, whoever is in the role of mommy. And we also need rocking, which gives us a sense of peace or soothing. It's the opposite of violence. Children who have been rocked are less violent. Cuddling is another thing that we need to have. We need a physical sense of being cuddled and touched. Without that touch, we develop skin issues. You might want to remember skin and schiz, SCHIZ, schizophrenia, schizotypal, schizoid personality, schizoaffective disorder. The SCA diagnoses begin their life with skin issues. We call it adhesive identification. Without that sense of touch, we end up with a kind of sensory deprivation, and we don't have a sense of where we begin and where we end and others begin. We sometimes think that people can read our minds or that we can read theirs. There's a lack of physical sense of self that develops if we aren't touched enough. So how does a baby get a mom that doesn't touch her enough, or hold her enough, or cuddle her, or rock her? Probably the best odds would be postpartum depression. If the mom has postpartum depression, it's one of the best kept secrets, how deeply it goes. And a lot of times moms will leave the baby in the crib all day long, sometimes behind a closed door. And then dad comes home, she goes and gets the baby, and she hands the baby over to dad, and she says, I've been taking care of him all day long. He's your turn now. So there are other reasons, though, that the mom could be sickly, or the baby could have been sickly. The mom could have been hospitalized. The baby could have been hospitalized. The mom could have been an alcoholic or a drug user, or the mom could have simply been left in the crib herself and not have been able to pass on nurturing to her own child. So, how do you create a schizophrenic? The first thing you have to do is don't touch them enough. So we create skin issues. The second thing you need to do to create a schizophrenic is to repress their feelings and their truth, their thoughts, their words. You have to make it so that what they think isn't acceptable and what they feel isn't acceptable either. There's a repression ethic that comes with schizophrenia. Along with that repression ethic, there's usually a pretty deep loyalty to the parent that's repressing them. There's also an invasive factor in the parenting of a schizophrenic child. It's usually something like, I know what you're thinking, I know you, I know what your motives are, I get you better than you get you. So there's sort of a parent's in the kid's head already, and that can make the child feel really intruded on. And if you don't have a physical sense of yourself and somebody's in your head telling you what you think and what you mean, I think you can start to imagine how that works. Then there's another factor, which is in the childhood of a schizophrenic, there is a mind-warping experience that is mind-boggling, so much so that I am reluctant to use the term mind-warping. I think of it as mind-fucking. It is so serious. There usually is something that is absolutely insanity-producing in the way the child gets treated. And most people looking on would maybe even think that it's normal. So all of these experiences, from the repression ethic, the invasive dialogues, the mind warping experience, and the lack of skin, are all parental choices that favor the parent's needs over the child's needs. Now, as far as how do you make a paranoid schizophrenic, it's basically just add a little paranoia. That would be things like promises not kept. It would be possibly disturbing or traumatic experiences that take place out of the blue, or unpredictable criticism or unpredicted abuse. So you add those factors to schizophrenia and you will have a paranoid schizophrenic. Most of the families of schizophrenics that I have known on the surface appear normal, which contributes further to the impression that it must be genetic. Schizophrenics can be healed. It's not genetic. And yes, there has been damage done to their brain. Some parts of their brain are smaller and some parts of their brain are larger than the rest of us. Still, there's work that can be done to normalize their brain and to normalize their thinking. But the problem seems to be that as they start to become aware of what went wrong in their understanding of themselves and of their parents and of the world, they begin to talk about it. They start confronting their parents. Why did you say this? Why do you think this? Why did you treat me this way? And then the parents who brought their adult child to me to begin with, all of a sudden are saying things like, well, if you're going to start to act that way, or if you start crying like that, I'm going to in this therapy, we're not putting up with this. And so now there's the taboo surfaces, and now we see what the schizophrenic has been held down by. It's the ideation of the parents. So it's heartbreaking to take a client all the way to the edge of healing and then have the parent shut them down and push them back. I now won't treat a schizophrenic unless the family is completely on board and they're willing to acknowledge the mistakes that they made in order to heal their child.